Hello. Hyperpigmentation, it's the most common problem which we're facing in the salons, in the clinics. It can affect self-confidence, it can affect awareness of the patients, of the clients, and it can really change the quality of life. That's why we created Luminescens, the kit which is able to tackle the problem, which is able to solve the problem of the hyperpigmentation and melasma. Melasma is the chronic condition which is being treated professional in the salon, but requires also home care, which is going to work on the cellular level in order to decrease the production of the enzyme. How the pigmentation is created. So the hyperpigmentation and melasma are created due to increased melanin production and deposition in the basal layer of the skin. It manifests as the dark spots on the skin. In case of melasma, it's usually on both sides of the skin, above the lip, on the forehead. It can affect both men and women. Up to 80% of women are affected by melasma. Up to 60% of men are affected by the pigmentation. Hyperpigmentation can be created due to different factors. First of all, it's UV light, hormones, mechanical damages, and inflammation. Melanin synthesis, melanogenesis. How the pigment is created. Melanin synthesis is carried out by the specific cells of epidermis, called melanocytes, in particular structures called melanosomes. Melanosomes migrate to the surface of the skin through the dendrites, through the different active movements mediated by the transport protein. First of all, we need to understand the function of the melanocytes. So the function of the melanocytes is the protective one. It protects the skin from the both physical or UV damage. Damage is releasing the hormone MSH, melanocyte stimulating hormone, that activates melanocytes, which leads to release of the pigment. MC1R receptor stimulates melanosomes to produce melanin, starting from the amino acids tyrosine. Tyrosinase is responsible for the first step of tyrosine transformation, and it's the rate-limiting enzyme. This is why it's so important when we're speaking about pigmentation. It regulates the metabolism and the synthesis of the melanin transformation, and it's the first step of melanin synthesis. On this particular slide, you can see the full cascade of melanin synthesis, as the enzymes and mediators we mentioned are of the great importance, as those steps will be addressed by the particular ingredients in the therapy. The protocol with lightening and depigmenting activity is specifically designed for the treatment of the skin with pigmentation and melasma. The formulation is compatible with all the Fitzpatrick phototypes 1 to 6. It can be used all year round, and it does not cause excessive irritation. The depigmenting activity is carried out by specific active ingredients assisted by superficial peeling action that promotes epidermal renewal and speed up of metabolism and favors for delivery to deeper dermal layers. Luminescens depigmenting and whitening solution contains of 2 vials for full outpatient treatment and 1 professional cream for a home care use. What are the strengths of luminescence treatment? First of all, it's innovation in the market. Innovative formulation for outpatient mesotherapy treatment, which is a patent pending. There's no waiting time. There's no treatment time, which would require long waiting time from the patient. The application doesn't have to be kept for hours. It's a very quick procedure, in-salon procedure. It has no negative impact on daily life. It has cutting-edge formulation full of active ingredients made for home treatment and professional treatment with the proven results. Regarding the mechanism of action, strategies for the brighter skin, blockage of melanocytic enzymes, blockage of excessive melanin formation, antioxidant and free radical action, increased turnover and hyperpigmentation removal, but also moisturizing and strengthening action for the skin barrier. On this slide, you can see clinically tested results, scientifically proven reduction of stains and pigmentation, which was dermatologically tested. 95% of our patients have seen a positive results after the treatment. They say that the treatment has reduced skin pigmentation and melasma. The mesotherapy treatment was pleasant, without any side effects, and home product is comfortable and easy to use. Meso patented formula. All the ingredients focus on reduction of the hyperpigmentation, but also strengthening of the skin. The first ingredient is a transenamic acid. It's a derivative of an essential amino acid lysine. The most important function of this product, of this component, is going to be antiplasmin activity. The blocking of the plasmin allows to prevent the full cascade of the melanin production. Aminoethylphosphinic acid stabilizes dopachrome and prevents further steps of melanin creation. Arbutrin, it competes with dopa at its receptor site of tyrosinase enzyme, acting as a substrate. It is a very good antioxidant and helps to reduce the amount of free radicals generated by UV light. The further ingredients will focus on stabilization of the melanin synthesis formation, will also strengthen the skin barrier. Rutin will strengthen the capillaries, will provide better oxidization of the skin. Salvia is going to be working as the anti-aging agent. It also moisturizing for the skin. Melissa, moisturizing, strengthening skin barrier. Oligopeptide 34, moisturizing and thickening the skin barrier, which will also help to prevent further pigmentation creation. Melanin formation and transport blockers, ellagic acid, sodium phytate, acetyl tetrapeptide 2, and also increase in the cellular turnover, salicylic acid, antioxidant dermo-normalizing agents, glutathione, potassium, sodium DNA, and hyaluronic acid. In case of hyaluronic acid, this is a very important component because we need to remember that formation of the pigment is also influenced by the hydration level of the skin, so we are preventing reoccurrence of the pigment. For the home care ingredients, once again, melanogenic enzyme blockers, transenamic acid, derivative of essential amino acid lysine, blocking all the cascade of melanin production. Aminoethylphosphinic acid stabilizes dopachrome, improves the skin metabolism. Arbutrin helps to reduce the amount of the free radicals generated by the UV rays. Oligopeptide 34, gablarin. Gablarin is very important in the product as it's licorice derivative and extremely powerful depigmentation agent. It's also tyrosinase inhibitor, and it's very important in this case. It prevents inflammation. So when we prevent inflammation occurring in the skin, we're preventing pigment from reoccurring. All the different components will help to strengthen the skin barrier, will work as depigmentation agents, increase in the cellular turnover, salicylic acid, citric acid, tartaric acid, and retinol. Retinol is one of those substances which is very well known if it comes to strengthening, thickening the skin barrier, but also reduction in the pigment. Melanin formation and transportation blockers, and antioxidants, hyaluronic acid, panthenol, tocopherol acetate. Once again, we need to pay attention to all those ingredients because they will prevent the hydration of the skin. They will increase the moisture in the skin, which will prevent the pigment from reoccurring. Hyaluronic acid and panthenol working in synergy will also rebuild the skin barrier after the professional treatment carried out in the salon.
Agnes just mentioned different active ingredients that we introduce in the formulation, and you can see here the 4 functional complexes that you will find in Luminescens. I would like to focus on the melanogenic enzyme inhibition and in general on enzyme inhibition, to explain a little bit further how the mechanism is brought on and why we introduce some specific active ingredients. First of all, I want to define what an enzyme is. So an enzyme is a chain of amino acids. It's a protein that helps us to catalyze a biological reaction. So we have the enzyme, we have the substrate. A complex between enzyme and substrate is created to give us a result, a product. Consider that this kind of reaction would be impossible without the existence of an enzyme. So it's very important to catalyze and to speed up biological reactions. Talking about the enzymatic inhibition, we have different kind of mechanisms. The first one that we see is the competitive inhibition. You can see here the competitive inhibition is when the inhibitor binds the enzymes at the substrate binding site. The second one is the non-competitive inhibition. Non-competitive inhibition means that the inhibitor binds the enzyme to a different binding site, different from the substrate one. This binding changes the shape of the enzyme, and so the enzyme is not able to perform its action anymore. So going specifically in some of the active ingredients that Agnes already explained, I want to recall a bit to show you some different aspects of luminescence mechanism of action. So first of all, we have tranexamic acid. Tranexamic acid is competitive inhibitor for tyrosine. So it blocks the action of tyrosinase competing with tyrosine. It's in the very first step of the cascade of melanin synthesis. Then we find arbutin. Arbutin has a similar mechanism of action, or better, it's the same mechanism of action of tranexamic acid, but it competes with another substrate because it's present at the second step of melanin synthesis. Then we have glargine. Glargine is a non-competitive inhibitor, so it means that competes with another binding site respect to the tyrosine. And finally, we find aminotylphosphinic acid. Aminotylphosphinic acid is a chelator, so it means that it stabilizes dopachrome, which is an intermediate of melanin synthesis, and it prevents the further step of melanin creation.
A luminescence protocol of use. Luminescence treatment is carried out in 2 stages. The first stage is the application in the professional clinic, so it's the microneedling treatment carried on by professional. For this treatment we use 2 milliliters of luminescence and application is microneedling. Second step of the treatment is luminescence home cream. The treatment starts the same day as the treatment in the clinic. So step-by-step protocol of use. Day 1, mesotherapy application in clinic plus post-treatment cream used by the patient at home. Applications from day 2 to day 7 of the luminescence home care twice a day. From day 8 to day 13, applications of the home cream once in the evening. And on day 14, the patient is returning to the clinic for the second microneedling treatment with luminescence. Once again, 2 milliliters of luminescence per session. There might be requirement for the next treatment to be carried out if melasma is very severe. We're going to carry out those treatments every 14 days. Application of the cream is going to be once a day now. For the best effect of luminescence treatment, recommended application time is 3 to 4 months of home application, as this is going to influence cell memory and we're going to ensure that melasma or hyperpigmentation is not returning. This is the protocol for 1 month. In case of the very severe cases of melasma, you might repeat the same protocol in the following month. Please remember that for the duration of the treatment, we're recommending to use SPF 50 couple of times a day. Luminescence home cream comes in the 30 milliliters box and it's designed to be given directly to the patients to continue home treatment. These are some before and after results. Results after 60 days of treatment. Results after 30 days of treatment. Results after 30 days of treatment. Thank you very much for watching.